When you go on this journey to the road to medical diagnosis, sometimes you have to talk to your friends and your family and say, look, I know you love me, I know you care about me. I have to do what I have to do. And only I know what that is. And I have to pursue this. And if they really love you and trust you and respect you, they will honor that. But you have to always stay open to reason because things change. In my case, what ultimately saved me was I found a set of problem-solving physicians. These problem-solving physicians are hard to find these days. Because ideally what you want is a physician who, when you walk in the room, they treat the person, the entire patient, as opposed to a specialist who just looks out for his or her specialty, whether it's a pulmonologist looking out for your lungs or a gastroenterologist looking out for your stomach, because they'll give you the all clear from their perspective. And you may move forward with the false notion that you're okay. You need someone who's going to listen to you and say, well, maybe I can't help you, but there's clearly something wrong, so I'm going to try to find the doctors to help you. I was lucky enough to find doctors like that. They put their heads together, they solved my problem. But when you're out there, be very careful, because specialists could deceive you. They don't mean to. They want to help you. Okay, that's one. And number two is that if you live in a rural area, that's another problem, because you may only have access to a limited number of doctors. So finding these problem-solving doctors is even harder to find. There's an answer to that in a second. But let me give you just an example of when I was an attorney and I took a check from someone as a retainer, meaning they retained me. I would always say to them, now your problem is my problem. So you don't have to worry about it because that's what you're paying me for. That's the kind of doctor you want. You want to find the one that's right for you, who you could explain what you've been going through and the frustrations. And if you're lucky enough, that doctor's going to corral a bunch of other doctors and get you answers. During this journey, when you're trying to get diagnosed, you may also run into medical professionals who are by the book, textbook. Meaning if they look at an MRI and there's not any sort of abnormality there, they move on. There's nothing wrong with you. Despite you crying, you're screaming in pain, you're on all sorts of medications. Textbook doctors also could give you a false hope that everything's fine. And I know this because I had a very bad back problem years ago. I ruptured a disc in my back. But my MRI was clean. There was nothing wrong with me as far as the MRI was concerned. I had months of trying to figure out how to solve this problem, because my insurance company would only reimburse me for an MRI because that was the defining exam. Somehow I found a doctor who was called a physiatrist, and he suggested a test to me called a discogram, which is kind of an archaic test that preceded MRIs. And basically what they did was they injected saline into my disc while I was laying under a fluoroscopy machine. And they took pictures. If the disc held the disc was okay. But if the saline exploded out of the disc, I had a ruptured disc. I had a ruptured disc at the L5, S1 levels. I had spine fusion surgery. My insurance company still wouldn't pay for anything because it all emanated from the MRI. So that's when I wrote my book, which I think a lot of you know, Confessions of a Professional Hospital Patient. And I chronicle my battle with the health insurance company. I redact all the names and whatnot, but you could see the back and forth because I won. I ultimately won. The lesson to be learned from textbook doctors is that they're not giving you answers. They're basically just responding to what they see. They want someone to come out of your body with a bullhorn to tell them what's wrong with you so they could treat you. Whether it's for legal reasons or maybe they're lazy, I have no idea. But they're not problem solvers. When you go down this journey to be diagnosed, and it's a difficult one, and it's a marathon, you need a problem solver. Now, if you are in a rural town, I think that problem has been fixed because of something called healthcare social media, which is the internet. Basically, it's all these technological tools that you could use on the internet. The Twitter hashtag for it is HCSM, the acronym, Healthcare Social Media. The wonderful thing about healthcare social media is that whether you go on Twitter or Facebook or a healthcare portal website, you could have almost instantaneous access to a database of patient information. Patients share stories of what happened to them, and it may be similar to what you're going through. Or by analogy, you could figure out what's wrong with you. Another great thing about healthcare social media is that you could participate by giving your own information. You know, tell people what's going on, what your symptoms are, the experiences that you've had, what you're trying to find, what medications you've been on, what's been ruled out. I mean, obviously, you're going to come across a bunch of virtual versions of like these doctors I said that really aren't very helpful, but you'll be able to weed that out. But there's gold in them hills, as they say. There's a lot of people online, myself included. I'm one of many who are very credible, who listen and engage. You need to participate, ask questions, observe. I mean, try a lot of different ways to get the information. But you're basically like a researcher. You're in the front lines. That's what healthcare social media can do. And I think it's something that really evens the playing field. Now, when you do all of this and you're in the middle of the journey, you need to be cognizant of the emotional effects of what you're doing. Because you don't want the emotional effects to be worse than the underlying illness. That's sort of like winning the battle but losing the war. You don't want that to happen. And also, if your loved ones are helping you, you don't want to get them emotionally upset because they don't want to see you suffer, and it's agonizing going through this. So always keep an eye on the emotional effects. Always keep an eye on what's happening to you as a result of you embarking upon this journey to be medically diagnosed. Let's face it, you know, going through this journey could be so depressing on a daily basis, on an annual basis. It could change your life. You could become a depressed person. So you'll get your answer, but life is not going to be very enjoyable to you. You can't let that happen to you. Then they win. I don't even know who I'm talking about when I say they, because everyone wants to help you, but I think you know what I mean. They is, you know, the doubters, the naysayers. You can't let them win. Yeah, you were right, but you did it because you had to do it. Don't let depression take over. Don't let something else become a bigger problem than what you were pursuing. Turn the page, move forward. I think you should be very proud of yourself for taking on this journey, because a lot of people give up. They just give up because they just can't take it. So, in summary, I think I've explained how to undertake this journey to the road to medical diagnosis. But the goal is to stave off all emotional effects as best you can. And you got to prepare yourself. How do you do that? Well, the first thing is you have to recognize that you could be dealing with a marathon, a very long process. So you have to sort of get your mind in tune with that. Secondly, you have to diversify your efforts and your research. You got to try everything. Going to doctors, word of mouth, the internet, Twitter, Facebook, everything. The third trick is, it's not a trick, but you must develop mental toughness. And you have to understand why it's important. You need a core of mental toughness. You need it to be so strong that if someone pushes you, you're not going to fall over because you're going to be pushed. Okay? You are going to be tested by people you love more than anyone on earth. They're going to look at you and tell you you're crazy. And you're going to have to look at them and say, I respect your opinion, but I am not. I have to pursue this. You have to be that tough, and it's very hard. And I think that you have to understand that going into this journey. And as soon as you understand that you have to diversify, that it's going to be a marathon, and that you have to be mentally tough, I think you are providing insulation from being affected too badly by the emotional aspects of this journey. The fourth tool, I would say, is that you must take advantage of healthcare social media. You must try to take advantage of the experiences and information that other patients share, or that you share. And when you share them, you have to share them in different ways. You have to engage people. You have to ask questions. Maybe you have to respond to their questions to gain their trust and become their friend. You got to be active. You have to be actively engaged. And when you do all these things, you're going to cut down on the time it takes to get a diagnosis. And then there's just certain characteristics that you have, or you have to learn how to fake them. You got to be resilient. You get knocked down, you got to get back up. You're goal-oriented. You are resilient. You got to be determined. You are determined to get an answer. Finally, probably the most important thing I could tell you is you must listen to your body, and you must trust your body. And I mean, you know, check in with it every once in a while, like I said, because your problem may have resolved itself. It may have gotten worse. You may need to ratchet up things. But you and your body have to be in tune and one. Thanks for watching, and if you have any feedback, please feel free to post something on the YouTube channel. Send me an email, michaelweiss@hospitalpatient.com. You can find me on Twitter, @hospitalpatient, which is one word. And please, please subscribe to this Pro Patient TV channel on YouTube. Tell your friends, and please check out the blog hospitalpatient.com. I think I'm starting to post some pretty interesting things and getting a really good response from it. So if you have any suggestions for topics you'd like me to address, I'm more than open to do it. Unfortunately, I know a lot about this stuff, and I really would like to share what I know so that it could help others. So please feel free to contact me, and I do sincerely appreciate your time. Thank you.